Hi, Neena Sharma welcomes you to a very exciting and a new show on eAwaaz, Let's Talk with Neena. You must be wondering what this show is all about. Well, you have heard of recipes, haven't you? Cooking recipes. But we will not be talking about cooking recipes here. We will be bringing you recipes, but recipes from the beauty world, recipes from health and fitness, recipes from medical aesthetics world, and recipes not national but international fashion world. Why? To guide you, to educate you, to connect you to the world-renowned professionals. So let's enhance your well-being, your personality. Let's talk with Neena on eAwaaz. Ladies and gentlemen, today's recipe is microneedling. I have a dear friend and a lovely guest on our show today from a very prestigious company called Salient. So let's talk to her, have a chat about microneedling. Welcome to our show, Gina Sleazy. Please tell us a little bit about yourself.
Thank you, Neena, and thank you for having me here. This is really exciting. My background is medical aesthetics. I've worked with various different clinics doing various different medical aesthetics treatments, laser hair removals, PRP, cool sculpting, various different treatments. What I do now is I actually do sales, but mostly training of microneedling and PRP with microneedling. And I travel mostly within Canada, and I train in different clinics. And I really do value the treatment, the results that this device actually provides, yes, or offers.
I must tell my viewers what this microneedling treatment is a very advanced treatment of skincare. So this has taken industry by storm because it's one of the latest, beauty treatments that's been offered all across the world, and especially in Canada. But one must be trained professionally to perform this treatment because it's very invasive, but it delivers results. So that's what Gina and myself were going to discuss. What is this microneedling all about? Gina, tell us a little bit about this company first of all, because I am always very, I give a lot of importance to the company, because this show is a professional show, and we only bring professionals to our studio. So talk to us about Salient. What Salient is all about? What do they sell? And obviously, then we're going to take a conversation into microneedling and in depth.
Absolutely. So Salient is a distributor, and their main focus is innovation and client training, client education. So we actually will source out, the president and our bosses will source out different newest technology and medical aesthetics all over the world, and then we will bring it to Canada, knowing that it does offer results. Very result-driven company. Some of the items that we have are some of the products that we're carrying right now. We have laser Soviora. We have JASIS, which is a RF microneedling, and RF stands for radio frequency. So sometimes microneedling might not be enough, and you need a little bit more for loose skin, and then you're adding my RF, which is radio frequency. We have the Eclipse Micropen, and I'll get to the Eclipse company in a minute, and then we have the Eclipse PRP. We also have one of the most well-known skincares in the world, and that's PCA. PCA is a US-based company, however, they're in over 80 countries.
So what really intrigues me actually, and that's why I wanted to let our viewers sort of, we want to talk about this company, this treatment called Recipe, I should say, is microneedling, is because our South Asian community, we have sort of skin type 4. so which we call dark skin color.
Yeah.
So we're not really dark, but we are dark enough.
Beautiful.
Where we suffer, a lot of our people, our community, we do suffer from aging,
yes,
which is a major factor,
yeah,
in your appearance.
Yeah.
So we suffer from aging, we suffer from acne.
Yes.
Sometimes the acne it starts at teenage years and it goes all the way to your menopause.
Yes.
And so that's what I am really excited to know, how microneedling can help us, or people with those kind of skin conditions. So please tell us, what exactly is microneedling?
Absolutely. So microneedling is also known as collagen induction therapy. What we're really doing is creating little channels onto the surface of the skin, sort of tricking the body into thinking there's damage so that it creates new collagen and new cells. As you mentioned, with aging, it's beautiful for just kind of giving that, working on those fine lines and wrinkles, overall skin textures, pores, blackheads. What I really like about microneedling is the acne scars. Like you said, we do have acne, and sometimes a lot of people that suffer from acne have acne scars, and so it is ideal for those acne scars, because what it's doing is breaking down that scar tissue and around those scars, and it's causing a sort of a new cell to grow and new skin to grow.
So basically, to put it in simple words, what my understanding is from your conversation, that all it does, it just creates little holes in the skin.
Yes.
Am I correct?
You're correct. We don't consider it holes because we don't want to scare anyone off. So we call it channels. But yes, you're absolutely correct. We use
tiny little holes.
Microneedles. Yes, that's hence microneedling. So we use small little needles. They're 32 gauge. They're very, very tiny. Okay. We kind of drill tiny little holes. If you, yeah.
That's interesting. So when you drill these little holes, would I not feel the pain?
So most clinics are offering numbing cream.
Okay.
So they'll apply numbing cream for about 20 minutes, and it's pretty comfortable. I've had it done. It's not fun. It definitely is not a facial, but it does. Ultimately, my goal is to, get results.
Okay.
And with good results, you do have to go through a little bit of discomfort.
So gone long, those days when back in the day when we used to go for a facial.
Yes.
I remember, I'm in this industry for the last 15 years.
Yes, I know.
I've got 7 diplomas under my belt. Having said that, I'm new to this treatment.
Yes.
And it absolutely amazes me, to be honest. Amazes me that the microneedling is just solving those issues and those problems we never thought and we had solution for.
Well, microneedling is wonderful treatment for our communities, our skin color. Unfortunately, we cannot, mostly cannot do a lot of lasers.
Yes.
Due to pigmentation in our skin.
Yes. So tell us why we cannot do laser. If say for example, if I had a skin, or if somebody has a skin which is pitted.
Yes.
It's got those little tiny little dents because I've had acne when I was young.
Yes.
And now, I never took care of the skin. For example, I have a lot of clients who come to me who had acne and they never took care of it in their young years. And as they, grew older, now in their professional world and they are professionals, yet the scars are, it's not really the scars, it's the dents are still there. Right? So tell us how exactly, and walk us through this process. And I know you've got this pen as well, this pen.
My favorite toy, yes.
So, such a small device.
Yes.
How exactly does it work if one was to go ahead with treating that issue of pitted skin?
So with the lasers, there are 2 different kinds of treatments when it comes to those big devices. There's intense pulse light. Some of your viewers might have heard of as IPL.
Yes.
Yeah, and then there's lasers. What they are doing is really targeting pigment in the skin.
Okay. Pigment is basically the color.
The color
of the skin.
The color of the skin and the color underneath. There are lasers that are quite aggressive where they're burning the surface of the skin off.
Okay.
And when they're doing that, they're also targeting the pigment.
Okay.
So if you're a skin type 5, 6,
means dark skin.
Darker skin. My apologies. Skin. Yes.
Brown skin or
brown skin. Exactly, or from Middle East or Asia, anywhere with skin types darker.
Okay.
I guess I'm so accustomed to saying, yeah, I'm so accustomed to using the Fitzpatrick skin type, but darker skin.
Okay.
You can cause hyperpigmentation.
Okay.
What that is you can cause darker spots.
Oh boy.
Yes. So ideally, this is the safest treatment for us.
Okay.
When it comes to pitted acne scars. This is the best treatment out there for us.
Sorry to interrupt you, Gina, but I'm just going to share this incident with you about this client of mine. She came to me a little while back, and she went to a clinic.
Yeah.
And she, brown skin.
Yeah.
She had a lot of melasma pigmentation here.
Yeah.
And what she did was she went to a clinic to get you know, to get it sorted.
Yeah.
So what they did IPL on her.
Ooh.
Intense pulse light. So she not only paid so much money, which is in a couple of $1,000.
Yeah.
She actually ended up with darker skin color.
So the fear is there.
Is that what we're talking about?
So the fear is there, and unfortunately, there's not enough education, not only to the consumers, but also there's not enough education and training to providers, to people that are doing those treatments. We know that the melasma are these cells that are underneath the skin that are hormone based. So if you've had spots that you appear during pregnancy, you have melasma.
Okay.
What I recommend for individuals that have melasma is sunscreen. It's vital that you wear sunscreen. Anything heat, and that's lasers and IPL, but anything heat, even when you're cooking and you're in front of the oven, you can actually, that melasma can trigger.
Yes.
And it can trigger, and it can speed up the process of those production of those melanocytes, and it can get darker.
Okay.
So
going back to the pitted skin.
Right.
So please walk us through how exactly that pen would work.
So
show us that and to our viewers.
Yeah.
And how the needles would work. How do you exactly, you know,
sure. So this is my demo needle, and this
Okay.
is the pen.
Okay.
There's 12 needles in there.
Okay.
That are 32 gauge. So what happens is when you have a scar, acne scar, they're called, any scar, you always have scar tissue affiliated with it.
Okay.
So what we're doing is we're going in around and kind of breaking apart that scar tissue.
Okay.
And sort of kind of getting the skin to kind of create new collagen and new cells.
Okay.
And that helps kind of elevate those pitted acne scars.
And how many treatments one needs?
Depends. We always say you always need a session of 3.
Okay.
If you don't have acne scars, you don't have a lot of aging scars, you always need a minimum of 3.
Okay.
It could go up to 6.
Right.
And my apologies, sorry to cut you off, but sometimes it might not be enough if the acne scars is too deep.
Yeah, so
then
you need anywhere from, they start to see the difference basically.
Yeah, they see the difference.
Between 3 and 6 treatments.
Yes.
And then each treatment, if I was to suffer from that condition, because a lot of our South Asian community do suffer from that condition, and
Correct.
sometimes it kind of, knocks their self-confidence.
Yes.
So if they go to a clinic.
Yes.
To have that treatment.
Yes.
So between 3 and 6 treatments, they will see the difference. Am I correct?
Right.
So
they will definitely see a difference. But if it's too deep, we do recommend either PRP, which is using your own plasma.
Yeah.
Also known. We don't claim that it's vampire facial, but it's also known as that. But using PRP, using your own plasma.
So there is treatments.
There's other treatments,
available.
and then lastly, but the best would probably be fillers.
Okay.
To use hyaluronic acid and fill that area.
Speaking of fillers, when you were, when we were setting up the studio and you showed us some of the products, one of your products, this one here, is hyaluronic acid.
Yes.
So I would like you to tell us about hyaluronic acid. Before we do that, I think I'm getting a signal for the break. So let's go on a break, and when we come back, we will be talking about this hyaluronic acid, which is responsible for your youthful appearance. So we were talking about hyaluronic acid. So let's talk to Gina and let's hear what exactly is hyaluronic acid, because everybody's talking about hyaluronic acid. So Gina, please tell us what is hyaluronic acid and how can it help a skin which is suffering from aging.
Yeah.
So aging as well as you say texturizing, we need to texturize the skin, say for example.
A lot of the aging, to be honest, a lot of the skin concern and skin issues are from water loss.
Okay.
So they call it transepidermal water loss.
Okay.
So we're losing water on our skin and our skin is dehydrated. And what this is hyaluronic acid is, these molecules are made by your own skin, by your own body, and it's sugar based. This is not the same hyaluronic acid that gets injected to fill the skin. This is more of a topical treatment. Okay. It's safe enough to be used with microneedling. It has ceramides, niacinamide, and hyaluronic acid, sodium hyaluronate. So it has a lot of stuff that helps with hydration.
Right. So these are anti-aging ingredients?
Absolutely. Anti-aging, what it does is it hydrates your skin and gives it collagen. So in turn, that helps with the anti-aging process, yes.
So collagen is responsible for anybody's youthful appearance, am I correct?
That plump looking face.
The nice plump looking face.
Yeah, exactly. Absolutely.
So this, if I was to use this hyaluronic acid with that microneedling.
Yes.
So is that like a double whammy? So I'm not only creating the collagen that my body is producing, but I'm also filling it up with this hydrating hyaluronic acid. So it's a double whammy.
Well, there are two things that I could talk about when it comes to that. First of all, yes, it is more than a double whammy. Okay. What you're doing is actually causing, when you're doing it with microneedling, you're giving yourself 200% collagen.
Wow, 200%.
Your body.
Back in the day, they used to talk about, it's a collagen cream, and it wouldn't show any difference on my skin if I was to use it for 2 years. Even. Yeah. So this one you're saying is 200% more effective.
When you're doing it with microneedling.
Wow,
any hyaluronic acid. Yes. The other thing with our hyaluronic acid is we have a delivery system, a technology called Omnizom Delivery, which is basically holding those molecules and it's going down and releasing a little bit at a time over a 10-hour period.
Wow.
So that's why the hydration can last that long. So this hyaluronic acid, which is by PCA skin, can actually work up to 10 hours.
Wow.
There's studies, so it's not coming just from me and PCA. They actually did a study, and they're using, like I said, an Omnizom Delivery, which is a patented technology from Johnson & Johnson.
One thing always concerns me, Gina, and I have obviously worked with a plastic surgeon, and I I do check out, see things. I go, see a lot of patients, and I see clinics, I see the competition, what's happening in the industry. Yeah. So I'm pretty aware. But one thing that always concerns me is that our general, our clients or our public are not really aware of things such as which microneedling machine they should use or equipment they should use, because there is equipment which I'm not going to name anybody, but they are no-name equipment. They have needles, and then there is your equipment, obviously, which is Health Canada approved. So how can somebody differentiate and should consider, please talk to us, that why should they consider going to a clinic which is Health Canada approved equipment only?
Love
and
to.
Why is this so important?
Love to. Unfortunately, it's regulated. which means that Health Canada, when you bring in a device into Canada, you put it through regulations. You put it through safety testing. Absolutely.
Safety of the consumer.
Safety testing of the consumer. And what Health Canada does is it's a rigorous process where they go through and they want to make sure that it's safe enough for clients. And then they give you a certification.
Okay.
Unfortunately, there are a lot of companies that are bringing devices from outside of Canada and are using it. And to regulate that market, it's really tough, just because there are a lot of clinics out there.
I mean, my concern is always to, to our South Asian community especially, when you go and walk into a clinic, if they are not sure that this device is regulated by Health Canada, it's an invasive treatment.
Yes.
It draws blood to the surface.
Yes.
So that blood can be contagious, right?
Absolutely.
That can have a lot of diseases such as, Hep C, Hep A, and then obviously the HIV.
Yes.
So please talk to us about that.
Absolutely. Anytime you're breaking the skin, it is considered invasive. Anytime you're, when you're getting Health Canada approved, this is not just about Health Canada approved, it's by a company that's carrying that system.
Yes.
We as Salient are responsible in making sure that we have proper training for our clients. I've had clients where I see a lot of, or I've known of people that have seen a lot of complications from microneedlings, just because there's no training. You buy microneedling online and you start using it. This requires a whole day of training where I need to,
yes,
Nina,
myself.
you and I are going to be doing this very shortly.
Yes, ladies and gentlemen, I am also going to be trained. Although I have 15 years experience, 7 diplomas in the beauty industry, in aesthetics and other therapies, but I am still going to be going through rigorous training, obviously with Salient.
Yes.
And you are going to be my trainer, Gina.
Yes.
So yes, it's so important to be trained by professionals.
We have to ensure that we are seeing you do this. We are seeing you handle the pen safely. Safely, obviously. We want to see that you're able to understand complications, risks, able to do consultations. You're able to really educate your clients on how to
educate
post-care. Absolutely. Once we go through and we're confident that you're able to provide those treatments to your clients, we know that we're handing off our pen to someone that is capable.
Yes.
So then we certify you as a provider.
Wonderful. When we were talking about this before the show, about microneedling before the show, you showed me really great slide of the before and after skin.
Yes.
So would you mind sharing those with us, please? Because I saw a few of them if you go on your computer.
Yeah.
A few of them where there was a pitted skin, and then I saw amazing results. So please talk to us about that one. So there is a woman in the first slide, in the picture, who has a lot of acne. And the next photo is of her where the acne is really cleared up.
So these slides are, there are different clinics that are giving us the rights to use these slides. The first one that you see is...
And these are real people.
They are real people, yes. There's no Photoshop here. The first patient that you see is, it's a month of a treatment, a month. And that's 6 treatments. As you can see, there's nothing else that was used. She's seen some amazing results with not only the brightening of the skin, overall brightening, but also with the acne and the acne scars.
That's amazing. I mean, there's so many women who suffer from self-esteem issues. And when you sit down with them, sometimes it's just as little as skin problem.
Absolutely.
Isn't it?
Yeah,
so it
definitely
really kind of knocks their self-confidence if their skin is not clear.
Yes.
And a lot of men suffer from it as well.
Oh.
So talk to us. Talk to us about
teenage boys are one of the I guess the highest numbers in acne scars when around their
on the skin?
16, 17, 13.
Is it because they have more oil in their skin, boys?
Or hormone.
Young men?
It's completely hormone related.
So a lot of oil.
Yes.
And this is a treatment that they can
Amongst
go
others, but yes, this is one of the best treatments.
Wow.
Yeah, as you can see the next picture, or the next before and after, this one is 5 treatments. He's a skin type 4, and there's 5 treatments, and you can see results from not only the acne, but also the brightening and just an overall skin improvement.
So skin type 4 is basically brown skin.
Light brown skin.
Light brown skin.
Yes.
Skin like mine, sort of.
I probably would put you under a 5. I'm a 5.
Okay, okay.
Yeah.
So I'm a little bit lighter than mine. So that's more of a Mediterranean skin.
Exactly.
But there's lots of, our community, we have people range from very dark skin to very light skin.
I know. Right? I was in Pakistan, and I remember, there's from 3 all the way to 6.
Yes.
I don't see a lot of 6, but 3 to 5.
Yes.
Yeah.
So there's a lot of people who are very, very light.
Yes.
They live in the mountain area, or they grew up there, or obviously it's the genes as well.
Yeah.
And then there is people who are, they're very dark as well.
Yeah.
So it's really people range from skin type 3, which is light,
Yes.
to skin type 6.
Yep.
Or 5.
Yeah, totally. I mean, and this is good for all skin types.
Yes.
But again, you gotta go to a clinic that is certified. You gotta go to a clinic that's using a Health Canada approved device.
Yes.
They are trained and they recognize skin. They will ensure that there's minimal complications.
Right. Wow. So, talk to us about other devices. There's a lot of devices.
Yeah.
Talk to us about price. I'm not going to ask you, obviously, on the air how much does this device go for.
Yes.
But we have viewers who want to choose a clinic who offer a microneedling treatment.
Yeah.
Then we have viewers. We have a lot of our community.
Yeah.
There's a lot of entrepreneurs.
Yes.
So there's women who have businesses,
Yes.
or there is people who have businesses in the skincare.
Right.
If they were to go look for your device,
Yes.
and I know it's reasonably priced.
Yes.
And where should they go?
So right now, if they are looking to open up a clinic or to start a new business, ideally we want them to be, medical estheticians or estheticians and trained. They'd have to go to salientmed.com.
So salientmed.com is a company they can go for, and they can always look for you, Gina.
Yes.
Gina, well, you are going to be my trainer, that's for sure. This is it for today. So अगले वीक आप आपसे फिर मुलाकात रहेगी, and we will be here with a new segment, Let's Talk with Nina. तो तब तक के लिए नीना को इजाज़त दीजिए, and there's a number on the screen if you need to get in touch with me for your skincare problems or any issue you have in terms of laser hair removal. Until then, have a great week. Thank you.